The following case study is about Dimitre, a patient who recently experienced a distal radius and ulna fracture, by Chris Anadoma and Taylor Vento. Dmitry is a 92-year-old Russian male. He is currently widowed and lives by himself. Recently, he slipped and fell in his bathroom. He called his neighbor, who drove him to the emergency room. X-rays revealed clean fractures to both his distal radius and ulna. There was no need for surgery to stabilize the fractures. Rather, his arm was placed in a full arm cast with elbow inflection in the emergency room. His neighbor then drove him home. He is currently receiving occupational therapy in his home via home health. Fractures of the wrist are very common, especially when falls occur and an individual falls onto an outstretched hand. Fractures of the wrist represent approximately a quarter of all fractures of limbs. Although the fall was believed to have contributed to Dimitri's fractures, the risk factors of advanced age and possible osteoporosis increase the chances of limb fractures. A distal radius fracture, such as the fracture that Dimitre experienced, almost always occurs about 1 inch from the end of the bone and is also called a Colles fracture.
The reason for Dimitri's referral to occupational therapy were to address his upper extremity range of motion, upper extremity strength, fine and gross motor coordination, in order to increase his participation and independence in ADLs and IADLs. Dimitri's past medical history includes non-insulin dependent diabetes, congestive heart failure, a cataract removed from his left eye, alcohol abuse, and cataract and macular degeneration in his right eye. Dimitre currently lives alone at home in a first-floor apartment. He's widowed with 2 sons, one who passed away at 70 from a heart attack and the second who is in a nursing home with Parkinson's disease. He used to live with his son prior to his nursing home placement. Dimitre came to the U.S. 20 years ago from Russia to be near his sons and has no other living family. He has a pet bird that he's very fond of and has conversations with and calls it his family. He lets the bird out of the cage daily, and it's trained to go back in when he tells it to. And he never learned English very well.
Prior to his injury, Dimitre was very independent. He was independent in ADLs, IADLs, and community mobility. He did not drive, however, he walked to the store almost daily, and he also had the ability to rely on a volunteer service to take him to doctor appointments and to visit his son in the nursing home. Dimitre appreciates his independence and wants to get back to using his right hand like before in order to increase his independence. Currently, Dimitre is taking medication for congestive heart failure, non-insulin dependent diabetes, and also medication for his recent injury to address the pain involved. He has no known allergies. He lives alone in his first-floor apartment, and for leisure, he enjoys caring for his pet bird, and he also enjoys walking daily. Looking at the provided X-Mind map, as one can see, Dimitre has several areas needing assessment, including upper extremity range of motion, upper extremity strength, hand dexterity and coordination, sensation, edema, transfers, cognition regarding memory and safety awareness, as well as functional ADL and IADL tasks. To measure his range of motion, we would conduct a functional screen to see if movements are within functional limits. We would follow this by further goniometer measurements to see how well his upper extremity joints are moving. For strength, we would do a muscle strength screen followed by more thorough MMT measurements of upper extremity muscle groups to see how strong his upper extremity muscles are. For hand dexterity and coordination, we would administer the Jebsen test of hand function. This assesses fine motor skills and weighted and non-weighted hand function activities during performance of activities of daily living, which is an area of occupation affected by Dimitri's recent injuries. For sensation, we would test sharp-dull and also use the SEMS Weinstein monofilaments assessment to test the sensation of his affected right upper extremity. For edema, we would use the figure 8 method to take circumferential measurements of the edema in his right upper extremity And this would allow for comparison with later measurements to see if his edema is increasing or decreasing. For cognition, regarding memory, we would ask him to recall information about procedures or information from previous sessions. For safety awareness, we would administer a section of the KELS regarding safety. We would observe, and we would also ask him to identify safety concerns or precautions in his home, especially when in the kitchen and bathrooms. For ADLs, we would administer the FIM via observation of dressing and bathing tasks. And for his IADLs, we would observe him doing home management tasks as well as pet care in his home environment. The following strengths were found via patient interview and the previous stated assessments. Currently, one of Dimitri's strengths is his prior level of function. He has no significant perceptual deficits. He has good range of motion in his entire left upper extremity, as well as good range of motion for all shoulder movements. His motor coordination for his left upper extremity is intact. For fine motor, his gross motor coordination is within functional limits for his left upper extremity. He is independent in all transfers. He requires min assist to button his shirt and zip his slacks. He ambulates at home with a homemade cane. He has a neighbor and social support that is willing to help. He enjoys walking daily and staying active. And he has a pet that he enjoys caring for, and that may be used for more motivation and therapy. He also demonstrates increased motivation to complete occupational therapy and get back to using his right hand like before.
Dimitri's weaknesses were identified based on assessment results and his history. He currently has no familial support and limited community mobility. There is a language barrier, and he does not like to ask for help and has a difficult time accepting it from others. He is currently demonstrating decreased memory, which affects his ability to remember to take his medications and is especially important now that he's taking pain medication. He has poor vision in his right eye and is right hand dominant, which is the affected upper extremity. He also has decreased sensation in his hands, including impaired sharp, dull, as well as numbness and tingling in the right hand and fingers. He also has decreased right upper extremity muscle strength and edema of the wrist and fingers. Dimitre is also experiencing pain with most right wrist movements and is showing decreased active range of motion in elbow extension, wrist flexion and extension, and in finger range of motion. He has impaired coordination for fine motor and dexterity with his right upper extremity, and gross motor is mildly impaired in the right upper extremity. Dimitre is also having difficulty with self-care, ADLs, and IADLs. He's having a hard time fastening and tying his shoes, as well as with managing his home, including meal prep, cleaning, and laundry. Dimitri's current problem areas regarding ADLs are that he currently showers with mod assist and dresses his upper and lower body with min assist. He's also min assist with fasteners and max assist for tying his shoes. As far as ADLs, Dimitre is having difficulty with home management, including meal prep, cleaning, and laundry. Dimitre currently needs additional education, including safety education for fall prevention and general education regarding his present condition in areas such as edema and pain management, implications and precautions for decreased sensation, medication management, and use of adaptive equipment. Therefore, OT will focus on increasing range of motion and building strength in Dimitri's right upper extremity, increasing his independence in ADL and IADL performance. He is insured under Medicare, and occupational performance areas affected are his ADLs, IADLs, and education. Dimitri's affected domains are shown below for the areas of performance skills, performance patterns, and context and environment. Affected domains in the areas of client factors and activity demands can be seen below. Regarding environmental and contextual considerations, it's important to ensure that Dimitre will be able to function independently and safely at home, since he did fall in the bathroom in his home and it will be his discharge environment. A home assessment should be completed in order to identify any safety hazards that may interfere with Dimitre's functioning, and all aspects of OT intervention and carryover will be in his home, which is ideal because it's his natural environment. Also of note is that Dimitre has a neighbor close by that's willing to help with day-to-day tasks at this time.
The intervention approaches that will be used for Dimitri's treatment are establish and restore, to restore his daily routines as well as range of motion and strength in his affected upper extremity, promote, to enhance his performance in his natural context via home health, as well as prevention, to prevent any further falls and to provide patient general safety education. Frames of reference that will be used include the biomechanical frame of reference to restore function by increasing his range of motion and muscle strength, as well as the rehabilitative frame of reference. And this will use Dimitri's occupations and environment to promote his rehabilitation with the use of adaptive equipment as necessary for tasks such as dressing. For ADLs, Dimitri's first long-term goal is that he will demonstrate increased independence in ADLs by discharge. The first short-term goal is by the end of 1 week, Dimitre will complete upper extremity dressing with no more than 2 tactile cues. His second short-term goal is that by the end of 2 weeks, he will complete lower extremity dressing with modified independence. His third short-term goal is by the end of 3 weeks, he will complete bathing with modified independence. Preparatory interventions for Dimitri's ADLs include physical agent modalities to prepare muscles for movement, strengthening and range of motion exercises using TheraBand and putty, and a home exercise program to prepare Dimitre for occupational performance. Some occupational-based interventions include daily ADL retraining by completing an ADL routine using adaptive equipment to make tasks easier and safer, including a reacher, sock aid, button hook, and tub bench. And this will also aid in the use of bilateral upper extremities and to promote safety by helping to prevent further falls in the bathroom. Daily ADL retraining can be graded by sequencing tasks, by having the patient perform part of the tasks, by fading verbal and physical cueing, and by increasing task complexity as he improves.
Long-term goal number 2 will address Dimitri's IADLs and states, patient will demonstrate increased independence in IADLs by discharge. This long-term goal will be addressed by the following short-term goals. Number 1. By the end of 1 week, patient will use a pill organizer to manage his medications independently. Number 2. By the end of 2 weeks, patient will open his bird's food container independently in order to provide care for his pet. And number 3. By the end of 5 weeks, patient will exhibit right upper extremity movements within functional limits during light meal preparation. For IADL interventions, preparatory interventions to address IADLs include physical agent modalities to prepare muscles for movement and hand strengthening exercises using TheraPutty. Purposeful interventions for Dimitre will involve interacting with his bird in general and include reaching for and carrying the bird with his arm and hand, cleaning the bird's cage, and sorting birdseed. Occupation-based interventions include preparing a simple meal of Dimitri's choosing, using modified techniques for cleaning, laundry, and other home management tasks, and establishing a pattern of taking his medications at certain times of the day, for example, at mealtimes.
Dimitri's last long-term goal addresses education. This is important since he will be receiving therapy at home and will continue to live alone. His long-term goal reads, patient will demonstrate increased knowledge of appropriate management of complications associated with injury and current level of function by discharge. The first short-term goal to address his education is, by the end of week 1, Dimitre will verbalize an increased understanding of fall prevention strategies to incorporate into daily functional mobility. His second short-term goal is, by the end of week 2, he will demonstrate proper technique for managing edema and pain in right upper extremity. And his last short-term goal is, by the end of week 3, Dimitre will verbalize implications and precautions for decreased sensation in his right upper extremity. The interventions that will be used to address education are the following. For preparatory methods, Dimitre will be provided with physical demonstration, discussions and verbalization, education handouts with pictures, as well as education handouts in Russian to address the language barrier. Occupation-based interventions include taking a walk around the neighborhood to address fall prevention strategies. This also incorporates one of Dimitre's leisures, which is walking, as well as establishing a pattern of self-care for pain and edema in preparation for his daily routine.
Recommended service delivery for OT will be in Dimitre's home in the mornings, 1 hour a day, 2 to 3 times a week for 3 months. After 3 months, it will be reevaluated to determine if additional therapy is necessary. As far as discharge planning, the desired outcome is supporting health and participation in life through engagement in occupation. So for Dimitre, engaging in things important to him include caring for his bird, walking, being independent, and taking steps toward getting better and using his hand like before. Dimitre met all 3 of his long-term goals in 3 months, and his current status for ADLs is that he is able to engage in upper and lower body dressing with 2 or less tactile cues and bathes with Mod Eye. For IADLs, Dimitre can independently feed and take care of his bird, is participating in medication management with new pill box with a timer to prompt his memory of when to take his medications, and he's able to make light meals independently. And for education, Dimitre demonstrates an increased understanding of, via verbalization, the need for fall prevention strategies and what the strategies are, how to appropriately treat edema and pain, and the implications of decreased sensation of his right upper extremity and what precautions need to be taken. Dimitre's discharge environment is that he will continue to live in his home, and because he's living on his own at home, education should continue to be emphasized, and upon discharge, he was provided with all necessary educational information to refer to in both English and Russian.
For more information on wrist fractures and associated treatments and how occupational therapy can make a difference, please refer to the following references. Thank you for viewing our presentation.